All right. So if everyone could just make sure their phones or computers are on mute, and I'll just again run through this. There's not very much, but just a reminder. All of this information should have been emailed to your contact person at your schools. And I know some people from Grand Traverse County is on this call. Things may be a little bit different for your county. So this is primarily towards the counties in Mid-Michigan, Central, and District Health Department number 10. But again, this should have been mailed to all your point of contacts. If you didn't get this, talk to whoever your point of contact is, make sure they're forwarding things to you. And if there's any issues, make sure your point of contact's information is updated with us. I know we've been trying to work on keeping those as up to date as possible. Later in the presentation, I'll talk about the updated materials from the state. And these slides will be sent out to you and posted on our website. So again, I just wanted to have all this here for you. Their school information is at this web link. Their new infographic is here. Information from the CDC that's of interest is here. Everything is basically the same. There might be some different icons on it for the different districts, but for Mid-Michigan District Health Department, Central Michigan District Health Department, District Health Department number 10, and I listed the counties in those districts. All of the information is in our COVID sections in the school section. So again, the link to everything is here, and then the links to the individual materials are listed here as well. So again, I'll be talking about those materials, and these are the locations where you can find them if for chance can't find the emails that they came in. So back the week of September 12th, we did send an update email. In that, I sent a couple of infographics from the CDC that I thought were good illustrations of what to do if you were exposed and what to do if you tested positive. I also had made some updates to a handout you can send out to your parents and your faculty as well as to what to do if you have symptoms of COVID or if you test positive for COVID, and then just other general symptoms and illnesses, when you can stay in school, when you can return to school with those types of symptoms and illnesses. So we call that the Parent Illness Guide. At that point, I had also updated this flow table. It's a 2-page guide to help really walk people through what to do if they have symptoms of COVID, if they test positive for COVID, if they've been exposed to COVID. I put a QR code to direct people to an isolation and exposure calculator from the CDC because we were getting some questions about those types of things. So again, that was sent out, and it is on our web pages, as I just mentioned. So really walks people through exactly what to do in every single scenario, and that can be used with all your families, your staff, put on your website, used in any way you want to. We did send out an email along with those materials, just as a reminder to really make sure that people who do have signs of a significant illness that can be contagious should stay home until those guidelines are met. And again, directing back towards that Parent Illness Guide and the Communicable Disease Guide for schools, just because we have been hearing that some of the old policies have been coming back where students might be incentivized to attend school while sick, or punished if they're missing school by no longer allowing for excused absences. And also shared some information that we had gotten from the state, just reminding schools that they do have vendors, which are essentially independent companies that provide on-site COVID testing. So basically they'll do it for you rather than you have to do it yourself. And so they do have those companies available that can partner with you, and then shared the form that you can fill out if you are interested in that, and links to more information on that. and also shared information that there were some pretty minor updates made to the Managing Communicable Diseases in School document, which is really a phenomenal guide. It seems a little long, but it has just exceptional guidance if you ever have questions, concerns about any communicable disease management in schools, whether it's COVID, flu, whatever. That is a fantastic first go-to. So last week, pretty much a week ago from today, we shared an updated infographic from the state. Their attempt was just to make it simpler. There really is nothing significantly new here. The old one used to say infection and quarantine, even though on the right it never did recommend quarantine. It recommended just masking. So they did change it to say exposure instead of quarantine. This top portion is the same. Stay home for 5 days, wear a mask from days 6 through 10 after infection or illness. And then it used to have here after exposure that if it was a household contact, you should wear a mask. And if it was a non-household exposure, you could consider wearing a mask. Now it's consistent with what the CDC recommends, and what we have recommended is just anyone who's been exposed should wear a mask. So that's just the general same for everybody recommendation that if you've been exposed, you should wear a mask. Again, this is not an order. There's no orders for masking. We don't really expect you're not going to know who's all been exposed. So it's just something you want to recommend and, encourage people to do have masks available. But, again, we understand that it's not going to be completely followed. But that's the only change there, is just consolidating that to one recommendation to make it simpler. And again, now it does comply, or it does equal the same recommendation as the CDC. I'm not going to read through all of this, but I just wanted to copy and paste all this in the slideshow so that, again, everybody will have it, the same as the email said last week. But this information came from MDHHS as well. It's just basically their recommendations for school, now that school's already started, but it's basically the same as what CDC and what we have recommended. Just directing you to the CDC guidance, recommending what considerations to keep in mind, encouraging you to recommend vaccinations, giving you information and reminders about testing that is available to you through the state of Michigan, reminding you that you can use masks. The other things you can use in terms of personal protective equipment like masks, and just things to consider. A reminder that ventilation and improvements and good ventilation is very important to keeping kids healthy for other reasons than just COVID. Reminder of isolation and exposure recommendations. Reporting, there was some minor changes, and it actually is not a change from the law, but just some exceptions that they have allowed us to allow, essentially. You do have to report COVID within 24 hours because it is on the reportable disease list. They are saying that depending on what works best for everybody involved, you could report an aggregate count. So let's say you had 5 cases of COVID in students or faculty come to your attention today. Rather than reporting each individual case to us at the end of the day, you could just tell us you had 5 cases of COVID. However, you still have to keep all of the specific information about the names, date of birth, when their symptoms started, what their addresses are, and all of that. Because if an outbreak or something were to develop, the health department may need to get that information from you. You can still report just all of the information and have the health department hold that for you. So what we are recommending, and I know some have already figured this all out, is just to communicate with your county health department nurse or your HRA or whoever your liaison is at the health department and just determine what's going to be the most convenient for all of you. Again, whether it's just easier to write it all down and send it all in once a day, or write it down and keep it in one spot and then send in an aggregate count. But essentially, you're still reporting it within 24 hours every day. But they are trying to give a little wiggle room to make those legal requirements as simple as possible. I know that's confusing. Basically, if you have questions on that, talk to your point of contact at your county and work out what's easiest, because that's just going to make it a lot more clear between the two of you. I just wanted to throw in a little bit of data before I finish up. The one thing with masks, it is still recommended that if you are at a high community level, universal masking should be recommended. In general, really everywhere, that's getting to be pretty challenging to follow, and it does vary widely. I mean, for example, you can see that, 3 weeks ago, none of our counties were high. Last week, we had 2 counties that were in high areas, Clare and Clinton. And then this week we have 2 counties that were in high, Mecosta and Gratiot. And this is based on data that's kind of a week old. So, when it's changing every single week and that data is already a week old, it is a bit challenging to then say, well, now you should mask on data that will probably be different in a week. If we're seeing persistently high levels that are not decreasing, that might be a bit different. But just to kind of give you an idea, overall, you can see we're getting more and more green, which is good. This is a projection for the next couple of seasons. You'll get us through winter and into spring, so up through April. This is with 50% error rate. And this is kind of the rate of error the state's been following. This first scenario here is with us getting boosters out in early September, which we have, and no new variants really hitting the scene. The second scenario is boosters out early September and a new variant that's about that escapes the booster by about 50%. Sometime before December. So the perfect scenario shows things gradually decreasing and us making it through spring doing pretty well. If we were to have a new variant, we might expect a blip just before the holidays. That's the current outlook. And if you go to COVID-19 scenario modelinghub.org, they have scenarios for many different situations and for hospitalizations and different things if you happen to be interested. So I know that's a question we often get is, what's it going to look like? Are we going to have another spike in the winter? So this is what the experts are thinking will happen. Again, it just kind of depends if we'll have another variant or not. So fingers crossed. Right now, pretty much everything is still Omicron. There are some newer subvariants of Omicron, but they still seem to respond well to the new booster. So that actually is all that I had for slides. I am going to stop sharing just so that I can take questions more easily through the chat. If you have any questions, put them in the chat. And for those that don't have access to the chat, I will take questions by phone right after. And actually, I don't see anything at all in the chat. So if anyone has any questions, go ahead and ask or add it to the chat, whatever works. So the question is, will more tests be available for the schools in the future? I've not heard anything from the state about them not being available, so you should have tests available to you through the state of Michigan. So again, unless there's been some availability issue. So if you go to I'm trying to find the website for you. If you go to the state school website, which is michigan.gov/coronavirus/resources, and then in the resources page, there will be one that says K through 12 schools. You will find a tab on there that talks about testing resources. There should be information there on getting tests. And then also, when I send you the slide deck, there was a slide on there that talked about testing, and there's lots of links there on how to get tests. Can you send me the information sent recently which you reviewed today at the beginning of the call? So I will get that information sent out to you again. Let me just copy and paste your email address. Oh, so Mary, okay, thanks, Marie. All right. Any other questions? And we know most testing, at least I feel like most testing is being done with antigen testing and likely with home testing. And so we know that the case counts are really low, falsely low. So probably there is more COVID out there. But, this is just a point where we have to transition into learning to function with COVID. There are concerns that this flu season could be a more severe one. Australia's been dealing with a pretty significant flu season, and that is often something that the health community looks to as an indicator for what our flu season will be like. So I would encourage you to encourage staff, and as much as you're comfortable, students, for getting flu vaccines this year. And again, be cognizant of people with fever and illness and getting them home. I don't, people get sick, that happens. I just don't want schools to have to close. That's my biggest concern. Is I don't want kids to miss school, but I just don't want schools to have to close because so many kids are sick. Again, that Managing Communicable Diseases in Schools does an excellent job of really helping you to know when should somebody go home, when are they okay to be in school, and managing those types of issues. So if you guys need anything else or any help with any of that, just let us know. But I'll take one more call for questions. All right. Well, it was pretty easy, guys. We really don't expect much else to happen or much to change. The state has pretty much guaranteed us that no matter what happens, there really won't be any new orders coming out. So just trying to make our new normals happen. So you guys keep having a good year and keep us posted if you have any questions or concerns. We'll get these slides out to you, and if you need anything else, let us know. Yeah, and if you guys did not see any emails come to you, again, somebody at your school should be getting emails from us, and if you're not getting them, find out who is your point of contact and really make sure they're forwarding them to you. Or if you want your point of contact changed to somebody different, you can let us know. Sometimes it goes to an administrative assistant or something when it really should be going to a school nurse or a superintendent or somebody else. So, and if you can't figure it out, let us know and we'll try to figure it out for you. So, All right, guys, thank you. Have a good rest of your week, and we'll send out any new updates or anything else that seems like it might be useful to you as it comes across our desks. So, all right, guys, thanks a lot.